Today I'll be demonstrating how to use our multi-panel drug residue test cassette. This residue test is designed to detect the presence of multiple substances from a collected sample. Before opening the pouch, take a moment to verify which substances the cassette is configured to detect. The test panel is clearly printed on the outside of the package. To perform the test, put on a pair of disposable gloves and ensure you have the included buffer bottle and test cassette ready. First, open the pouch and remove the test cassette. On the cassette itself, you'll see the drugs being tested clearly printed below each panel. In this example, the cassette tests for fentanyl, cocaine, heroin, methamphetamine, and ketamine. Test panels can be customized to meet your specific testing needs. You'll also notice the control line, the test line, and the individual sample wells where the buffer solution is added. To begin testing, unscrew the cap from the buffer bottle. You'll see a swab attached to the cap. Place the buffer bottle on a flat surface and ensure not to spill the buffer solution inside. Using the swab, collect a sample from the surface you wish to test. This can be done by swabbing any surface, swabbing an object, or swabbing fingertips. If a visible residue or substance is present, gently dab the swab onto the residue to collect a small sample. Once the sample has been collected, place the swab back into the buffer bottle and tighten the cap securely. Shake the bottle 10 to 15 times to thoroughly mix the sample with the buffer solution. Next, unscrew the dispensing cap and add 3 drops into each sample well on the cassette. Once the sample has been added, you'll see the liquid migrate up each test window of the test strip. Allow the test to develop for 5 to 10 minutes before reading the results. Do not interpret the results after 10 minutes. Once the appropriate time has elapsed, you're ready to interpret the results. If both the control line and test line appear, the result is negative. If only the control line appears and the test line is absent, the result is positive. The control line must always be present for the result to be considered valid. If the control line does not appear, the test is invalid and should be repeated using a new test cassette. For complete testing procedures and additional information, please refer to the instructions for use included with your test kit.